or multiple pregnancy. Now, this is on rise these days because of IVF conceptions and also otherwise. So, let's understand why twin pregnancy is important. Now, twin pregnancy, that is when apart from one, there is one more. There are two fetuses. Now, this can be diagnosed as early as in the first scan, that is in the dating scan or the early pregnancy scan, which is generally done from 6 to 8 weeks of gestation. Here we count the number of sacs, we count the number of fetuses, number of yolk sacs, the heartbeats, and we know that there are multiple fetuses. It is one, two, three, or how many. Apart from the fetus, we also check the placenta. So that categorizes the multiple pregnancies into pregnancies or fetuses which have same placenta and sharing, or there are different placentas. That is, each fetus has its own placenta. So the conditions where each fetus has its own placenta, that is dichorionic twins or trichorionic triplets or quadrichorionic quadruplets. Such cases are better because that fetus has its own placenta which is supplying blood flow and nutrition to it. But if there is a condition where two fetuses are sharing the circulation from one placenta, that is called as monochorionic diamniotic twin pregnancies. Now, because logically thinking also, because there is sharing of nutrition and blood flow happening between two fetuses of the nutrition coming from one placenta, there is always a tug of war. Now, it's not necessary that always it is going to be 50-50% sharing. Even a 60-40% sharing is okay. But when the sharing becomes really imbalanced, that is, a lot of nutrition is going to one fetus and very less going to the other one, then there's an imbalance. So one fetus is not growing properly and the other is growing too much. So these are the PTTS, twin to twin transfusion syndrome. So this is a complication of monochorionic twin pregnancy. Also, another complication is selective FGR. That is, one fetus has a growth restriction and the other one is growing normally because the blood flow nutrition going to the smaller fetus is less than what is expected. So these kind of complications are something which we can expect in monochorionic pregnancy. Also, there is a problem with cervical uh, length because as the pregnancy grows and as the second trimester ends, the weight of the two fetuses, two placentae, that amniotic fluid becomes more than what is there generally in a single fetus or single pregnancy. So this logically and very naturally increases the pressure on the cervix. So the cervix, not in all cases, but there is a tendency of the cervix to shorten. So shortening of cervix, opening of the internal os is something which we encounter more in multiple pregnancies, and hence we need to be very cautious and we need to be monitoring the cervical length at each scan that we see. So if the pregnancy is monochorionic diamniotic twins, then we have to see them every 2 weeks. Okay, that is every 15 days we have to check the fetal growth, the amniotic fluid, the cervical length, and that we have to keep doing every 2 weeks because we don't know when the complication is going to arise. On the other hand, if it is a dichorionic diamniotic twin pregnancy, then we can monitor them every monthly. That is, a scan is done every 4 weeks or in a month. And again, we check the same thing, that is the growth of both fetuses, amniotic fluid, the cervical length. So this is how monitoring and managing twin pregnancies is a little different as compared to singleton pregnancies. And these days we also have high risk cases like IVF conceptions coming in. So that makes it a more frequent. So we encounter such kind of pregnancies more often these days. And hence we know and we should also tell the couple should understand that this pregnancy is going to need special care and a little frequent visits to the doctor.